Defense walked through the different time Clancy sought psychiatric help, including 2 calls to crisis services and eventual referral.
Thoughts were worried about her baby, the new baby she had, the infant, as well as if she's being addicted to Ativan, is what she told you, right?
Yes.
And again, thoughts of wanting to die, but there was no plan.
Correct.
Next page, risk assessment. There's a whole lot of stuff on it, these pages. I'm just trying to cut to the chase here. So you see where it says risk assessment?
I am trying to find it. 1 second.
Yep. Under it's under risk assessment.
I'm taking a look.
Okay.
I see protective factors, but I don't see risk assessment.
Okay, let me ask you, under risk assessment on December 2nd, when you asked her about that, at that point that she again admitted to suicidal ideation, right?
Yes.
It was passive.
Yes.
It says plan to go to ER if she feels unsafe or has a plan, right?
Yes.
And then farther down, you have current medications, and she was on quetiapine or Seroquel, right?
Yes.
Fluoxetine or Prozac, right?
Correct.
Lorazepam or Ativan, right?
Yes.
Mirtazapine or Remeron, right?
Yes.
And that was all active prescriptions that she had on December 2nd, right?
Yes.
Told you that she is seeking counseling for postpartum anxiety, right?
Yes.
Do you have on December 2nd, continuing on with your evaluation, where it says clinical notes? Do you have the clinical notes?
1 second.
What I could do is read what I have rather than stand next to you. And if you trust me that I'm not misrepresenting it, I mean, I'm just reading off of this to make it quicker for you if
Okay.
it refreshes your memory. If it doesn't, I can walk up and show it to you, okay?
Okay.
On that date, your notes say patient requested addiction support services. Do you recall that?
Yes.
And that you indicated that you would be sending patient addiction support resources by my chart, or the message thing, right?
Correct.
You then indicate that based on history reported, patient meets the criteria for postpartum anxiety, right?
Yes.
That she would benefit from OP therapy. What does that mean?
Yes, from outpatient therapy services.
PHP?
Yes, partial hospitalization program.
IOP?
Intensive outpatient program.
And that you then helped her out by bridging the therapy services, right?
Yes.
You then noted again postpartum anxiety on December 2nd, according to your notes, right?
Yes.
Okay. Now, did you know that she had been seeking and receiving therapy? I don't know if that's therapy or counseling or that type of thing. Like there's a woman that works in your business that provides therapy, right?
Yeah, so that person would be me.
So did she come to see you for therapy?
Yes.
How many times?
4.
So is it fair to say that she was more than willing to accept help from somebody like you?
Yes.
She didn't appear to be avoiding any therapy when recommended, right? If you could, Ms. Dukes, please look at, I think it was December 12th was the next time perhaps that you saw her,
Okay.
unless it's there's another intervening period.
So there's December 12th, and then there's December 5th.
Oh, okay. So if you could pull out December 5th,
Yes.
and if I can come up and look at it.
Yeah.
The testimony here establishes that Lindsay was participating in outpatient treatment and accepting recommendations for additional care. The questioning then turned to what happened when her symptoms worsened.
All right. So on December 5th, again, you were meeting with her for therapy. therapeutic intervention, right?
Yes.
And that on this occasion, she reported she had a difficult weekend, right?
Yes.
Intrusive thoughts of wanting to die, right?
Yes.
That she contacted Aspire Crisis Support, right?
Yes.
She met with an Aspire clinician, right?
Yes.
And what happened when she met with the Aspire clinician?
She met with the clinician virtually and was told that she did not meet the criteria for inpatient treatment due to not having any suicidal ideation plan.
So if she said, in addition to the fact that she's been in counseling and therapy and seeing psychiatrists and on medications for the past 3 months or whatever the period ultimately would be, and that she wanted to kill herself, didn't want to be here, couldn't care if she died, they told her because she didn't have a plan that they couldn't help her?
Correct.
Did they, to your knowledge, make any recommendations? Or did they recommended that she attend a day program?
Yes.
All right. And that person from Aspire then said he would send her patient resources, right?
Correct.
But nothing ever happened. He never sent her any. You did, but he never sent her any patient resources, right? If you know.
Not to my knowledge.
Okay. All right. So she had you at least to talk to and counsel and advise her. You continued on to make your observations. Fair to say that pretty much things stayed the same as far as her appearance, appearing anxious, appearing sad, unable to relate to people, that type of thing?
Correct.
Okay. Then you have, as a chief complaint of present illness, and again, that was, oh, wait a minute.
That's not my note.
That's not you, okay. All right, so you can hold on to that again.
Yep. Thank you.
Next time you saw her would be December 12th, is that correct?
Correct.
All right. Now, on December 12th, that was a teleconference that she had called by an appointment with you?
Yes.
And at that point, she reported that she had a difficult weekend and was experiencing intrusive thoughts of wanting to. Do you have it in front of you? I don't want to take advantage of it.
Hold on one second.
Yep.
I don't see the 12th in here.
Okay. Page 28.
Page 28.
And just for the record, I think, Your Honor, that she's looking at the actual exhibit. Am I right? That's the exhibit? That's in evidence? No, it's not. Oh, okay. Can it be in evidence? Can I offer that? Yeah, okay. Can I offer that?
Any objection? Sure, yeah. Ma'am, if I could just add that.
Do you have December 12th? Again, I could do what I did before.
She probably had it before.
Right, yeah.
Okay.
It references providers' interventions, and that would that be you, provider?
Correct.
Okay. And you're talking about symptom management, and yet again, she's reporting she had a difficult weekend, experienced intrusive thoughts, wanted to die, didn't have a plan for suicidal plan, but she contacted Crisis over the weekend, and that would be, again, Aspire, apparently, right? Because there were
Correct.
2 times she contacted Aspire, not once.
Correct.
Twice. Both times they told her that there's nothing they could do for her, right?
Correct.
And she told you that she was going to start a PHP in Norwell on December 20th, right?
Correct.
But in fact, you were able to, knowing people that you may have and pull strings, you were able to try to get her into the Rhode Island Women and Infants program, right?
Correct.
Which is a really pretty good program.
Correct.
And did you know that she did, in fact, go to Women and Infants on December 20th? She didn't go to the Norwell program. She went to Women and Infants program, and that she was there for the day and that they basically turned her away.
I did know that she went to the Women and Infants program. I was not sure of the date.
Okay. So if I suggest to you it was the same date that she had told you that she was going to go to the program in Norwell on December 20th, and then that you and Nicole Harden Francis reviewed various options, one of which was that, which made sense, to attend the Women and Infants program, IOP or PHP program, right?
Correct.
And that she, patient, provided you with verbal consent.
Correct.
To sign whatever had to be signed and get her into that program, right?
Correct.
So you know that she did on December 20th, after not getting anywhere with Aspire ×2, and after dealing with Gelada for all those times that she dealt with her, the other one, Tufts, you were trying to get her into this program, which would be pretty good for a woman that had postpartum problems, right?
Correct.
And you made your referral, you opened the door for her, and she got in there to at least be interviewed, right?
Correct.
The next step discussed was Women and Infants in Rhode Island. The provider testified that she helped make the referral, and Lindsay gave consent for the information needed to pursue the program.
And they didn't take her, right?
Correct.
You know why?
I am not aware as to why.
Would you be surprised if I told you that they indicated that they could not help her out because their diagnosis or secondary diagnosis was that she was over-medicated?
Repeat the question?
Would it surprise you to know that they indicated that they couldn't treat her as a woman with postpartum psychosis or postpartum depression or postpartum anxiety or any of that because their opinion was that she was suffering from an over-medication?
It would surprise me, yes.
But you don't know?
I do not know.
Okay. Did you know that the records from Women and Infants indicate that, in fact, on that very same day, they reached out to Nurse Gelada and asked her to call them so that they could discuss the medication, and Gelada never got back to her?
I was not aware of that.
I'm sorry?
I was not aware of that.
Okay. I think the district attorney had asked you a question about the last time that you saw her or had any activity with her was on December 19th. Is that right?
Correct.
Okay. And I may have misunderstood. Did she ask you, did you call Lindsay 4 times and she never got back to you that day, or is that just a list of different things that you did for her?
That's a list of different things that I did for her that day.
Okay, so you were calling other contacts, you were talking to Patrick, you would contact her. I mean, she certainly was not avoiding you. That's
Yes, we were in communication.
all right. You're familiar with, maybe you are, the what's called the Edinburgh scale?
I'm aware of it, yes.
And did she have the Edinburgh scale administered to her, to your knowledge?
To my knowledge, no.
Okay. What is polypharmacy? What does that mean?
Polypharmacy?
Yeah. You ever heard of that, polypharmacy?
I've heard of it, but not sure of the exact
Okay. That's
definition.
okay.
Dukes confirmed Lindsay contacted Crisis Services twice and that she helped facilitate the Women and Infants referral. But when asked why Lindsay wasn't accepted that program, she testified that she did not know.